everyone, welcome. Thanks for joining us. I'm Stacy. I work at Phoenix Children's Hospital in the marketing department. I'm here with Dr. Teresa Grebe. She's one of our geneticists and medical director of our 22q clinic. We are going to be talking about 22q today, so thank you for joining us. If you have any questions along the way, please just feel free to type them in the comment section and we will make sure we get to them. If you have any questions following the Facebook Live, please add them to the comment section as well, and we'll make sure Dr. Grebe gets them. All right, so thanks for joining us, Dr. Grebe.
My pleasure. Thanks for having me.
Of course. Our first question, can you explain what is 22q deletion syndrome?
Sure. So 22q deletion syndrome goes by a lot of names, actually. In the past, it was known by another name that some people are more familiar with called DeGeorge syndrome. Also, Sprinson syndrome actually has a lot of different names over time, but the 22q refers to the fact that people with this condition have a small missing piece on one of their chromosomes, the number 22 chromosome, and that's what that refers to. And I was going to show you a picture just of chromosomes to explain what that is. This is a picture of chromosomes from a person's test, potentially, and the 22s are two of the smallest chromosomes there. So a person with this would have two copies, but one might have a little missing piece.
Okay.
And the effects of that are different in different people, but it's associated with a variety of different medical problems that I can talk about.
And how common is it? Is it fairly common?
It's fairly common. It's probably much more common than we realize. There's been different studies to look at how common it is, and they range from about 1 in 4,000 people. Okay. Some studies even 1 in 2,000. So it's actually the most common, what we call microdeletion syndrome in the general population. So as far as conditions go, it's pretty common.
And how do you diagnose it?
So there are several types of tests that we can do. The genetic type of test, I showed you pictures of the chromosomes. If we were to do this regular test, the missing section is just too small to see on a regular chromosome test. So we order one of two different special tests, one called a FISH test, which doesn't refer to fish in the ocean, but it's a chromosome test that looks for that little missing piece of the Q11.2 band. So a FISH test is probably the most common test that people have had. The other top test that we do now more often is called a chromosome microarray, or CMA. So both of them we usually do on blood, and sometimes we do a cheek swab, which kids obviously like better. So those are the two tests usually used to diagnose it.
Okay, and how do you determine which sort of test? Does it just depend on the patient, or?
Do you mean blood versus the cheek swab? Some of that's dependent, unfortunately, on insurance and what's available. But we try to do the least invasive whenever possible.
Okay. And what are the symptoms of 22q?
That's a good question too, because usually the most common presenting symptom is a problem with the heart, so a congenital heart defect, but that isn't true for every child, so there's really a broad spectrum of symptoms that we can see, and for that reason we've tried to raise awareness that we need to think about 22q in kids with a variety of different health issues. So, as I said, heart defects are often the most common sign, and sometimes a cardiologist recognizes because there are specific types of heart defects that are more common. So the cardiologist will often consult us or even send the test themselves if they're very suspicious. And that may be diagnosed even prenatally sometimes, before birth or shortly after birth. Some children don't have heart issues, and they may be picked up by another type of specialist, say a craniofacial surgeon, because they have a problem with their palate. We call it cleft palate, and that's a hole in the roof of the mouth. So that's the second most common finding that we see. I've had some patients who've been diagnosed by one of our immunologists because they often have immune problems, so not a strongly working immune system to fight infections, so they may see a specialist because of repeated infections. And that was one of the cardinal features. And yet another small group of patients have been picked up because of low calcium in their blood, and that can cause cramps or seizures. And probably the final group are some children who kind of escape all the more serious health issues but have some learning or developmental problems, and they may not be recognized or undergo any testing until they're older in school, maybe even elementary school, and then they're having some learning issues and they get diagnosed for that reason, or speech issues. So
it sounds like they could be diagnosed at sort of any early age.
At different ages, that's right. We've had some adults diagnosed as well. So yeah, there's a very broad range, and for that reason we know we really need to think about it as physicians when we're seeing children for a variety of health reasons.
And is it hereditary? So do you often see it if a parent has it, is a child more likely to get it, or?
So on the basis of it being a genetic condition, it can be hereditary, but what we see most often is that the child who's diagnosed is usually the first in the family.
Okay.
So 93% of the time, the child is the first person in the family. And only about 7% of the time have studies shown that we detect it in one of the parents. But in theory that can be. So when I meet a family, I'm always very careful to talk to the parents about any, maybe mild symptoms that they might have had, and if they didn't have the opportunity to see a specialist, occasionally they might have not been diagnosed, and we do see that sometimes. So it is hereditary in that sense, because when we have children, we pass on one of our chromosomes of each pair, and so a person with 22q can pass it on to their children.
Okay.
So we've had some of our patients who have now grown up, and they may have had heart surgery, they're doing great, and now they're young adults and having children of their own. So we have had some of our patients who have had an affected child, so it can be passed on.
Okay. And is it, if one child has it, can another child in the same family potentially get it, or?
They can. It's not an absolute, but because our chromosomes come in pairs, as I said, so we have 2 copies of chromosome 22, and in this syndrome, it's only one of the 2 chromosomes that is affected. The other one is usually normal without the deletion.
Okay.
So for a couple who have a child or a parent who has it, their chance of passing it on to their future children is 50-50.
Okay.
1 out of 2, kind of like flipping a coin. And it has no predilection for male or female, mother or dad. It's equal that way.
And what does the 22nd chromosome do?
Oh, that's a tougher question. So each chromosome is actually a package of many genes. And it's actually the genes, the individual genes, that are the instructions really for how our bodies are put together. I call it the blueprint. And each chromosome, therefore, has genes that can have a variety of functions. Our bodies really aren't organized that one chromosome is the heart chromosome or the brain chromosome, but the genes in each chromosome are mixed up a bit and have different functions. So in that region of the deletion, which in most people is about the same size, there's 45 plus genes that are missing, at least the one of the 2 copies. There's a number of genes in there. There's a lot of research going on right now to understand what each of those genes do, and we don't have full understanding of the function of all of the genes. But we do know there's at least several critical genes. There's a gene called TBX1 that is a gene very important in heart formation, for instance. So that one is well known. There's some other genes that are very important in brain development. So different things. So I guess the answer to your question is the 22 chromosome does lots of things.
Okay.
So hence the different kind of health issues that people can have with it.
Sounds like it. Okay. What is VCFS and how does it relate to 22q?
So that kind of goes back to your first question about what is 22q. So VCFS stands for VCFS, velocardiofacial syndrome, is another name for 22q.
Okay.
So before our genetic testing technology was really developed, diagnoses of conditions were made by physicians such as myself who had training to recognize syndromes just based on examining the child. The DeGeorge syndrome was first described by Dr. DeGeorge, who was an endocrinologist, and he had seen a number of children in his practice with low calcium and immune system problems, and some characteristic facial features in common. So I don't know if he named it or someone else did, but it was DeGeorge syndrome after him.
Okay.
The VCSF was described by a different doctor, actually a speech pathologist, who noted that he saw a group of children who had problems with their palate and their speech. That was Dr. Sprinson. So that condition was separately called Sprinson syndrome or velocardiofacial. It wasn't until this genetic testing technology came about, the FISH that I mentioned, that we realized those aren't 2 different conditions. They're actually one and the same. It's just kind of a spectrum of symptoms, but it's all the same thing, basically.
Okay. What is involved in the care for a patient who has 22q?
I feel really strongly that having a multidisciplinary approach to caring for patients is really the best to give, the most quality medical care for our patients, children and adults alike, and that means that they see a team of doctors, so more than one, basically. We have a number of specialists on our medical team in our 22Q clinic who all see the children and adults. We don't take the place of their pediatrician, so certainly they still need their regular pediatrician or family doctor for checkups and all well-child things. Immunizations are super important. But generally, the other specialists that should be part of the child's medical team would be a cardiologist to evaluate their heart, including an echocardiogram, which is an ultrasound of the heart. And sometimes that could be normal, and then they might not really need to see the cardiologist forever. They need to see the craniofacial surgeon who checks the palate, and a speech therapist. They work in conjunction to see if the palate is closing tightly and if it's affecting speech or swallowing. Because a lot of the babies with the palate problem, it affects feeding, and so sometimes they might need a speech therapist to help with what we call feeding therapy.
Okay.
They need to have their hearing tested, and we have an ear, nose, and throat doctor on our team. They see genetics. Sometimes an endocrinologist who is a hormone specialist to check various hormone levels and the calcium. And if they're having a lot of infections, the immunologist, who is a doctor who assesses immune system. Some of the kids see different therapists, so a physical therapist, occupational or speech therapist. And then sometimes rarely other specialists like orthopedics or GI as well. Probably another very important person on our medical team is our developmental doctor. So we know that most children and individuals with 22Q have some degree of learning problems, and again, it varies. But an important member of our team is the developmental pediatrician who sees all of the children, and then sometimes up through school age to help with school planning and so forth. Some of the older individuals with 22Q may experience some form of mental illness, which unfortunately is a component for some individuals. So we have a psychiatrist on our team who can help with any of those issues, be they emotional, such as anxiety, attention deficit, or any more serious issues in adulthood.
Okay.
So we have a large team, the largest here at the hospital.
And
in
it's
our
all
clinic.
available at Phoenix Children's, right? One-stop shop for them?
It is, yeah. Our team, and it's a challenge to get our team together because we have so many team members, but we do all come together and see the children on the day of the clinic. They get to see everybody all in one day.
Oh, that's really nice. It makes it easy.
Yeah, I think it's important because our families have so much to do, and it's hard enough to take a day off of work for one appointment, but if you had to do 10 separate days,
Different days.
it'd be really hard. So.
Especially if you're living throughout the valley and
Yes, I'm driving a long way to get here. Right.
That's
So we try to make it as easy as possible for families.
And you mentioned adults. So does our program treat children and adults?
It does, actually, yeah. So we have been running our clinic for about 3 years. We now have close to 150 to 200 patients, and among them we have a number of adults.
Oh, wow.
Yeah, at least 10, and we have some families with an affected parent and child or more than one child. And we have, like I said, some of our younger patients who've grown up at PCH, had their heart surgery, growing up in our community, and now are young adults, and they're seeing our adult congenital cardiologist, Dr. Moe. And I see them, I always say in genetics, we're the only ones, so we do age 0 to 99. So, yeah, so we have designated some of our clinic days as adult days, where we want to see the older children and teens and adults, and then other days are pediatric days. So I'm trying to group the patients so that we have closer to the same age range on the same day.
Okay.
So.
All right. Looks like we're getting a question. So we'll go on to the next one, and then we'll get right back to that one. What can families expect during their appointments? I know it's nice that they are able to come all in one day and get it all done. I would guess they would have to commit a full day to see all of those different specialties.
That's the downside. It's a long day. It's a long day. So families are asked to arrive at 7:30 in the morning to register in the Heart Center, and their morning is spent in the Heart Center, where they will see multiple different specialists. They will see the cardiologist and may or may not get some heart tests done, such as the echocardiogram. They'll see genetics, myself. They will see the developmental doctor, the physical therapist, and the occupational therapist. So that fills the entire morning. Then families have lunch together, and we have members of our wonderful local support group. Mostly one member, Kelly Calcaterra, who comes and has lunch with them and really fills them in on our supportive community that we have here. After lunch, they usually will get some lab work done, and then from 2 to about 3:30 or 4 in the afternoon, they see the rest of the medical team in a different part of the hospital, all on the same floor. So they'll see the plastic surgeon, the ENT doctor, the speech therapist, and our orthodontist also. It's a very important part of our team. Yeah, and then they're done about 3:30 or 4.
Okay, so not too bad. I mean, full day, but at least they're not making multiple trips down to the hospital.
Right. And then after they leave, our team of physicians, all of our team members, we meet about 4 o'clock, and we sit down at the table, and then we discuss, each of our impressions and recommendations for the child, and discuss it amongst ourselves, because sometimes a child might need some more evaluations, imaging testing, or a surgery, but planning that surgery might be crucial depending on their age, and if they need a palate surgery, we want to make sure the heart is stable enough for that. And so the dialogue between our team members is really crucial, beneficial and crucial for the child. So we formulate a plan, and then as a director, I compile a team report based on each individual team member's reports, and then I take on ordering any additional referrals, imaging, whatever they need, and communicate that back to the family, the primary care doctor, and the cardiologist.
Wow, we have a well-oiled machine
It's
happening
taken a
here.
while, but we're still always room for improvement, but we're excited about our program, yeah.
All right, so the viewer question, are there any symptoms a parent might notice that should cause them to ask about 22q?
That's a great question. So I did mention, earlier about the most obvious causes for referral, which would be a known heart problem, but not everyone has that. One thing that sometimes happens is a child is noted to have some speech problems, and they may see a speech therapist. And speech therapy is amazing. It really does benefit the child, and in most cases will improve their speech over a period of time. But sometimes a child could have what we call a hypernasal voice, meaning that air is escaping through the defect in the palate, and that's a sort of a voice quality difference. But some children, maybe if they've been having speech therapy for 5 years or more, and that's not going away, then it might be time to think about 22q and have the palate evaluated.
Okay.
And also just in general, I think a child with a mild learning issue or some anxiety in a learning issue, they all merit an evaluation in genetics to see if it could be 22q or even some other genetic condition that we could help with.
And they can come here to Phoenix Children's.
They can come
for
to
that
our
evaluation.
genetics clinic to be seen. Absolutely. So they wouldn't be seen in our 22q clinic unless they were diagnosed.
Okay.
In other words, if they had a test that was positive. But the first step for evaluation is to see one of us, myself or my 3 partners here in the clinic for the test.
Okay.
Just the geneticist. But I think talking to the pediatrician also, your pediatrician is your lifeline, and so start with that person.
Okay. And when they have the test, the cheek swab or the blood test, how long does it usually take for that diagnosis?
Unfortunately, like most blood tests, it isn't back tomorrow or today. It usually takes a few weeks.
Okay.
So not too long, but
Okay.
a few weeks.
All
And then
right.
we would meet again and go over those results
results.
before
The
the child
initial
would come to
clinic.
the team.
Okay.
Yeah.
All right. Thank you. We have another question. What is the diagnosis for this plan of care today?
I'm not sure I'm following quite what the questioner had in mind.
Prescription?
I do want to answer that question. What is the prescription?
Oh, okay. So is there any prescriptions or anything that a patient with 22q would have to take, or any sort of plan that they would have to follow once they're at home, outside of the clinic?
So let me answer that in 2 parts. So in terms of the chromosome difference itself, right now we don't have a technology to fix the chromosome, unfortunately, but there's a lot of research in the news that I'm sure a lot of people have read about in terms of gene therapy. So maybe someday we will be able to actually fix the chromosome. But short of that, right now, we treat the symptoms and do the right evaluations that help the child with the medical problems that I mentioned. There are some guidelines that we have, like a time plan for the child from birth to adulthood, at what age we do certain things. So we recommend a once-a-year check. And if any of the lab values of certain things that I mentioned are off, so if the child has a low calcium, a low vitamin D, then the child would have a prescription for extra calcium or extra vitamin D. Some children have low thyroid hormone, so we would prescribe low thyroid hormone. If they have a heart problem, they might need some heart medications. some of the children might have some learning issues and might have some attention problems that would benefit from medication for attention deficit disorder. So I'm not sure if that's what the viewer was asking about. So those are some of the medications we use, but there really isn't one specific targeted to 22q.
Okay.
But definitely there are things we can do to treat all of the symptoms.
Okay. And the plan from birth to adulthood that they get, will they get that at their first appointment? Is that something?
It's more of a timeline that is shared among medical providers. We do have a very well put together book of information, and it might be in one of those papers, but we have a book of information that our Emily Library has wonderfully put together for us that we give to all the families. So that has a lot of information about all the health issues I've talked about, as well as recommended checkups and evaluations, so it might be in there. But what we do recommend is that they follow up with me once a year so that I can coordinate their care. That's kind of my job, is to keep tabs on what do they need
And
at
that's
different
how often
ages.
they usually come for clinic, about once a
They
year?
come about once every year or two to the clinic, and sometimes to certain providers they might come more frequently. If they
Okay.
need to see their cardiologist every 3 months, then the cardiologist would recommend that separately.
Okay.
But usually they come in once a year.
Okay. And you touched on some of the resources that are available for parents and families. The Emily Center, which is one of our education libraries, is
Wonderful.
fantastic. And then the lunch that they have with one of the support groups. Can you just elaborate on some of those resources that we have for families?
Absolutely. So we have 2 local Arizona support groups. So our 22q family support group is very active, a large number of families. They have a Facebook page, and we have some very active members who are always, eager to help support our families. They were meeting monthly for coffee and discussion at different locations, and those times and dates I know are available on their Facebook page. 22q Hearts of Hope is another group started by one of our members, a separate group. The aim is to raise money and awareness also for 22q. Our symposium is going to be also supported by the 22q Family Foundation, which is a national group.
Okay.
And that rose out of the previous Dempster Foundation that had some roots here at Phoenix Children's. So that is the national group that has a web page. They offer educational support as well. And I want to mention too, we have a speaker coming, an educational specialist, and she works with the National Foundation, and they offer some online educational help for families,
Okay, that's great.
where families can communicate with this nice lady who's an educator with special training in 22q. So that educational support is fantastic.
Okay. And the conference, tell us a little bit more about the conference, what families can expect. It's Saturday, March 4th.
Right, this is going to be our 3rd annual conference. It's Saturday morning, as you said, March 4th, here on campus in the Cohen Center, which is the first floor of the Rosenberg Building. It's a morning half-day event for families and other caregivers and individuals with 22q. It's a free event that we sponsor. I've tried to have speakers chosen each year that have been different. So this year we're really focusing a little bit more on development and learning support and other support for families. Our speakers include several of my team members. So Dr. Patricia Glick is one of our first speakers. She's our craniofacial orthodontist. So she has special training not only in orthodontics but craniofacial. So she sees a lot of our patients. She's going to talk about dental and orofacial manifestations. We have one of our child psychologists, Dr. Garrison, is going to be speaking. She's with the Craniofacial Center as well, sort of on the emotional needs of our children. Our speech therapist, Jessica Williams, is going to talk on the speech issues, and I mentioned that coincides with the palate problems and how those are treated. We have a speaker, Jana, from Raising Special Kids. Very excited to have her talk about extra support for families, and that's yet another group. I should have mentioned, I apologize. Raising Special Kids is a lot of support for families across the valley, including not just 22q. I was thinking mainly of specific 22q, but Raising Special Kids offers support for children with all types of medical disorders. And then the final speaker will be our educator, who's coming from Wisconsin, who's going to talk about educational planning for individuals with 22q. One other speaker who's not a professional but a patient herself, one of our family members. She's going to tell her personal story. She's delightful. I know she's going to share some really heartfelt insights about her experiences with 22q.
That's really neat.
Yeah.
And this is free, right?
This is free
Perfect.
breakfast. Yeah, we're very grateful for the support of Phoenix Children's for this event, and also the support of the, like I said, the 22Q Family Foundation, the national group. The Emily Center is going to be there. We're going to have some tables in the library with additional information, in addition to the speakers themselves, and an opportunity for some families also after the conference who would like more educational planning to sign up to meet with our education specialist. I said that is coming in, Donna Cutler-Landsman. That's an opportunity to meet with her for a brief one-on-one meeting.
Okay, great.
We have a limited number of spots to meet with her, but if families are interested and they want to call and sign up, she's willing to sit down with them, and families are encouraged to bring their child's school reports, and she will go through them individually with them.
That's great.
Yeah.
Sounds like it's going to be a great event. I know we have more information on our website, but if you want to register, you can go to phoenixchildrens.org/22Q conference.
And if people do not have access to the internet, they can call our office and speak with Vanessa, whose name I believe is there. Vanessa Stoll is our clinic coordinator, and she can register families as well and answer any questions.
And I'm sure we'll get information about this up on Facebook as well after this talk, so people can go on and register. All right,
Absolutely.
Saturday, March 4th, 7:30 to 12.
Mm-hmm.
All right. Is there anything else that we haven't touched on that you want to mention about about the team we have here, the multidisciplinary approach, things families should expect?
Yeah, I just want to reiterate that I think the multidisciplinary approach is the best for families, just coordinated care. In this day and age, you know, a lot of families see their doctors as super busy, don't have a lot of time, and rarely have the time to talk to other doctors. So I think that the nice benefit of our clinic is the doctors actually have time to talk to each other and make a plan. So I think that's the best for any child with special needs or multiple medical problems. We have a great team. They're very hardworking and dedicated, all have a lot of experience. So I'm really proud of them and the work we're doing. The final plug is we have 22Q at the Zoo Day. That's a fun family day in April we're planning. So let you know about that. It's a get-together for the families, but I like to come out and say hi too. So lots of stuff going on and a lot of research, and I think a lot of optimism for our families.
That's great.
With 22Q.
Okay. Looks like we're getting another viewer question.
Yes, so the viewer is asking about 22Q duplication syndrome. Let me mention that. So I've talked about 22Q. When we talk about 22Q for short, it really means the deletion or the missing piece on the chromosome. There are some individuals who have an extra copy, so we call that duplication, 22Q duplication. It has some overlapping symptoms and health issues with 22Q deletion. I have lots of patients with that. It tends to be a little bit milder. They may or may not have heart problems or some learning problems. So we do see children here in our genetics clinic with that, and happy to help with that condition. They don't usually need the entire medical team, so those children are not seen in our 22Q multidisciplinary clinic.
Okay.
But we definitely help guide care for those children as well. That's an excellent question, but it is a bit different.
Okay. All right. Well, again, if you think of any questions after our chat, just leave them in the comment section and we'll make sure Dr. Greavy gets them. Thanks for tuning in. Thank you for joining us, Dr. Greavy. This has been great. And be sure to register for the conference, Saturday, March 4th.